India has reason to be alarmed when it comes to matters of the heart. Widely regarded as the cardiovascular disease capital of the world, our country is home to nearly 55 million cases of heart disease nationwide. To shed more light on the emerging technologies that have the potential to reduce, if not prevent, the prevalence of heart disease pan-India, I am joined by a very distinguished guest. With that, I welcome you to our special feature, Revolutionizing Heart Health, Dr. A B Gopalamurugan, Senior Interventional Cardiologist and Electrophysiologist at MGM Healthcare, Chennai. Thank you so much for taking the time to speak with us. And for sake of some context setting, my understanding is that in India, over 5 million people die annually from cardiovascular disease. Right? Let's talk nature versus nurture here. To what extent is this a lifestyle disease, or is genetic predisposition largely to blame in your view?
Great question. It's largely lifestyle mediated. I say this because genetic predisposition hasn't changed. Our genetic makeup has been the same for years, but what has changed is lifestyle, and that keeps changing year after year. The lifestyle we had 20 years back is not the same lifestyle that we have now.
Sure.
And that's the same, comparing 30 years or 40 years back and now. And exponentially, heart disease keeps growing. Therefore, if genetic predisposition is largely the same, but lifestyle is changing and heart disease is increasing, logically it makes sense that it was indeed lifestyle that has led us to where we are now. So I think it's all lifestyle. It's pretty much problems we brought on to ourselves.
Well, a follow-up question there, what are the lifestyle changes that have dramatically proven to improve cardiovascular health?
Improve cardiovascular health is largely exercise. That seems to be one consistent, scientific and time-tested factor that minimizes cardiovascular health. So now, obviously, coming back to the first question also, a lot of exercise is lost because now we don't walk at all. We don't use these pair of organs God has given us called legs. We pretty much sit all the time, and we take a lift, and
very sedentary.
We sit everywhere, and we don't sit down to eat. So if you look at the populations across the world that has the longest lifespan, for example Japan, if you look at how they ate, they always sit very low down, and that used to be our traditional way of eating if you look back.
Right.
And we've changed our food habits to very westernized food habits, largely led by advertisements. I think these are the factors that has probably led to increase in heart health, and if we correct them, i.e. if we go back to where we were perhaps 20-30 years back, my strong feeling is that we will reduce cardiovascular health.
Very heartening to hear. And under this broad bucket of cardiovascular disease, heart attacks, heart failure, cardiac arrests, they're oftentimes lumped into one and assumed to be one and the same. For the benefit of our viewers, while none of it is of course good news, what differentiates one condition from another?
I think these are a lot of technical aspects to this, but it probably doesn't matter in the large scheme of things. From a patient perspective, from a layman's perspective,
right.
It probably doesn't matter, but let me spell it out.
Please.
What as specialists we consider each to be. For example, heart attack means blockage of blood vessels supplying the heart. Dot. That's it. That's what heart attack means to us. Or in medical terms, it's called myocardial infarction. That's what heart attack means. Cardiac arrest, as a specialist, means the heart has stopped.
I see.
And for the heart to stop, usually the pump will stop only when the electrical system fails. So the whole studio will become dark. Only if all the electrical system fails. That's exactly the same what happens with the heart. The heart has its own electrical system, and if the electrical system fails, the heart stops contracting. And that's what a cardiac arrest means. So cardiac arrest is not compatible with life. So usually they have only 3-4 minutes, and if the heart is not revived, they will not survive. That's what cardiac arrest means. But a heart attack, which is blockage of a blood vessel, doesn't necessarily lead to a cardiac arrest. But a blockage of a blood vessel can lead to a cardiac arrest. So a cardiac arrest is caused by a heart attack, not vice versa.
No, that's helpful.
So this is what we would take on if somebody says cardiac arrest, heart attack. On the other hand, heart failure means the pump function is lost.
I see.
So it is not something to do with blood vessels specifically or electrical system, although all these systems can lead to heart failure.
Sure.
The overall pump efficacy, if that is lost, then it's called heart failure. And what all causes heart failure? If the plumbing goes faulty, your heart will fail.
Yep.
If your electrical system goes faulty, your heart will fail. If your valves go faulty, your heart will fail. Or if the heart muscle gets damaged. Causes for heart failure, but broadly speaking, heart failure is pump efficacy being lost. Cardiac arrest is the heart stopping and is not compatible with life. Heart attack is blockage of blood vessel.
Doctor, thank you for breaking it down in layman language. And I've got a follow-up question for you there. You know, in the scenarios that you've just described, what is the role of that interventional cardiologist, and what distinguishes their role from their esteemed colleagues?
Now I'm going to be very biased, so because I'm an interventional cardiologist. Largely, when anything of the sort happens, if you can do something to fix it in the quickest manner without opening the chest, that logically sounds the right way to do, and that has been time tested also, and therefore pretty much in all these scenarios the first treatment is best delivered by an interventional cardiologist. Let me give you an example.
Please.
So if you have a heart attack, what we said, which is blockage of blood vessels, is a myocardial infarction. That's not compatible with life, and therefore the best treatment logically is to open the blood vessel. Proven for decades and decades is opening it with angioplasty, i.e. without opening the chest, through a small tube in a blood vessel, we get to the heart and pretty much open the blocked blood vessel, and that makes people live longer, survive. Usually when you have a heart attack, you get chest pain, you get into hospital, and the person who first sees you is an interventional cardiologist who will take you in and open the blocked vessel, and that's it. And that's where interventional cardiologists are more likely to be helpful than of course, our esteemed colleagues. If you have a cardiac arrest due to an electrical problem, if it's a slow heart rate or a fast heart rate, they're pretty much dealt with by a group of electrical specialists called electrophysiologists.
I see.
They are a branch of interventional cardiology where I'm an electrophysiologist, so I fix heart electrics also without opening the chest. So that's where an interventional cardiologist is most likely to offer some immediate help to the patient than other esteemed colleagues. Coming to heart failure, heart muscle disease, they largely revolve around medications. And these medications are dealt by cardiologists or interventional cardiologists, and when the heart muscle or the heart pump fails miserably, i.e. it's irreversibly damaged, then usually we change the heart, and that's transplant, which is the remit of a cardiac surgeon in association with a cardiologist. So that's how the roles are split.
Well, that's very helpful, and I'd love your take on what you consider to be some of the most cutting-edge developments and advances in the field of interventional cardiology in the, say, last 5 years alone.
There are lots. I think of all the specialities, this is a fact, I think cardiovascular treatments related to the heart is the biggest specialty, I would say, where a lot of R&D goes in. And the reason for that is very logical. It's not a money-making business. It's because the leading cause of death is indeed heart disease across the world. And therefore, everybody's in the world, all companies are doing everything possible to deal with it. And that's why a lot of R&D goes in. And that's why there are a lot of developments. Every 10 years is something new. Coming specifically to your question, I think the largest mind-blowing change that has happened to interventional cardiology is changing valves, heart valves, without open heart surgery. So if you think about it, 4 valves, the commonest valve is the aortic valve. When the heart pumps, the blood has to get out of a valve that opens every single beat. Valve, over time, becomes damaged because of age. And when that happens, it's a mechanical problem. It's not compatible with life, and the only treatment, there's no medication that will fix it, is to change the valve. To change the valve, for decades, it's been open heart surgery. And as I said earlier, this comes because of age. So they're all elderly patients, minimum 65 and above. And these patients are not very strong. They are frail by definition. And the disease also comes when they're elderly. And all these patients had to be undergoing open heart surgery, where the chest is opened, heart is stopped, take the valve out, put a new valve, restart the heart, close the chest, and then recovery, 3 days in ICU, 5 days in the ward, and maybe 3-4 weeks at home for complete recovery. This is a big ordeal
Of
in
course.
somebody beyond 60s. In the last 20 years, this has revolutionized to a point today where we can replace that valve without open heart surgery, no anesthesia.
Wow.
I would change the valve today, and the patient will go home tomorrow.
Amazing.
And this is, mind-boggling if you think about it, how we have progressed. So India has been slightly late in adopting this technology. So we did the first valve replacement in Chennai with an Evolute R valve. This procedure is called TAVR or TAVI, Transcatheter Aortic Valve Implantation.
Right.
And it's a boon for the elderly. And now, of course, all valves have a treatment equivalent or near surgical treatment for patients who can't have surgery. So I think that's the biggest development in interventional cardiology, changing valves without surgery.
Coming to angioplasties, which you touched upon earlier in the conversation,
Yeah.
to what extent have they become safer, more sophisticated, so on and so forth?
Angioplasties, let me spell out what angioplasties are for the common man. Angioplasty largely involves opening up blocked blood vessels.
Right.
To open this, there are several technologies now. Say 30 years back, we could only open some simple blood vessel blockages. If they're very complex, they can't be opened with conventional angioplasty, and they had to go open heart surgery, undergo open heart surgery, which is bypass operation, whereby these blocked vessels are essentially bypassed with an artificial vessel. That's what bypass operation means.
Sure.
Now, in the current day and age, 2023, there's pretty much no blood vessel in the world that cannot be opened with angioplasty. And the reason for that is technology. Now we, in the last 20 years, we use a drill for very, very hard blood vessel blockages. More recently, we use laser. These are all technologies essentially to open blood vessels that otherwise could not have been opened with conventional angioplasty. That is why now in 2023, pretty much we're able to fix every single blood vessel possible, and doesn't matter whether they have 1 block, 2 blocks or 3 blocks. We go through a heart team discussion, which is we have a surgeon, we have an interventional cardiologist, we have a general physician, and we decide what is the best course of action for that patient.
Phenomenal. And doctor, if I can ask you to look inwards for a moment, what do you consider to be some of the most rewarding aspects of being an interventional cardiologist, both on the personal front as well as professional?
I think it's down to what you like doing. I think sometimes people ask me, aren't you stressful? Aren't you stressed? I don't find them stressed because I think it's down to what you like doing. I like fixing broken hearts for a living. That's why I came into it.
Yeah.
So I like to fix the most complicated blood vessel related or heart related problems. I like to see that patient walk home and like to see that difference in quality of life that I've made. So I went to it because of passion. So I somehow I've never found it stressful, and I like doing what I'm doing. So I don't see the reason why I need any encouragement or motivation. I just do it because I like it.
Well, how challenging is it to continue to maintain that standard of excellence when it comes to providing patient care?
I've worked in different health systems. Majority of my time for over 17 years was in the United Kingdom, so that's a different healthcare system. I've been in the UK, in India only for the last 8 years. The challenge personally is that my challenge is not fixing the heart. That's the easiest part of my everyday job. My challenge is actually breaking myths and information overload with which the patient comes in to see me, and they come up with all sorts of terminologies.
Sure.
Oh, doctor, will this cure my disease? Is this a permanent cure? These words, I don't know where they get it from. And in fact, I had one patient who came and said, "Oh, doctor, I saw this interview where they said heart attack is a good thing," and they actually showed me an interview.
Right.
And this is because this is allowed in our country. Anybody can say anything.
Right.
It's disheartening to hear that, and it actually ruins the reputation of a country and the quality of information that is relayed to the public. That's the biggest challenge I face every day. So now, a patient comes to me because of blockage of blood vessels, they tell me, oh, is it permanent? You know, is it a cure?
Right.
Then I have to explain to them that if you have blood vessel disease, which is blockage of blood vessels, or if you have a heart attack, there is no cure, because the definition of cure is elimination of disease.
Right.
You cannot eliminate blood vessel disease. You can only palliate it by restoration of blood flow with artificial techniques. And one includes angioplasty, the other is bypass operation. They're both equally good now. Now angioplasty can do pretty much everything that bypass does.
Right.
But both don't cure. So when you go to a mechanic shop, you give your vehicle out for repair, you get a repaired old vehicle, you don't get a new vehicle.
Right.
So
that's fine line between treatment versus cure.
Absolutely. So there are diseases that there is no cure, because the definition is elimination, which means once you have palliation, restoration of normal blood supply, be it with bypass or angioplasty, you got to do everything that you had to do that led to the blockages, which is your lifestyle,
Right.
your eating habits,
Right.
your walking, your stress, your sleep, and what you do, your lifestyle. What led to it, the root cause has to be addressed.
Now, doctor, you've mentioned information overload, all right? And I think there's a huge tendency for the patient to, in this day and age, self-diagnose. They've seemingly become a doctor overnight, and they fire away with their opinions, which are oftentimes not substantiated. You know, what's the key to navigating that journey as a medical professional?
Problem is they have so much information from media.
Right.
Looking through internet is a good thing,
Right.
and it's a bad thing too. It depends on what you're looking for, because patients are nowadays overloaded with a lot of inaccurate information.
Right.
And that comes from a system that we're in. But on the other side, it doesn't mean that you don't have to go and check out your treatment. I think physicians, surgeons or cardiologists, whoever they may be, it's very important people spend time,
Right.
educate the patient,
Yeah.
and they can make an informed decision, and they should be allowed to get a second opinion.
Right.
There's no harm, you know.
Right.
Opinion, science is the same wherever
Yes.
you go, as long as you get the right scientific information from the right specialist. Again, this is very, very important. You know, if you want to go get a opinion on a Chinese dish, you need to go to a Chinese chef.
Yeah.
You can't go to any chef just because
Right.
they're a chef. There are
Right.
so many chefs, but you need to get the right specialist
Sure.
to get the right second opinion, and that's a good thing. And Google is good if you do targeted Googling, but if you Google chest pain, you'll get chest pain.
Sure. So, doctor, since there is a huge misinformation campaign out there, I'd like to sort of separate fact from fiction. What are the top 5 things, if you will, a patient ought to do if they believe they're demonstrating the signs and symptoms of cardiovascular disease?
I mean, cardiovascular disease is a very large spectrum. It can be blood vessel disease, electrical problems, pump problem, but I take it your question is largely what are the 4 or 5 things that patients can do to prevent themselves from getting heart disease?
Sure.
I think you need to do 10,000 steps a day. And this is scientific. If you do 10,000 steps, you live longer, you reduce the risk of heart disease, which means, what does it mean for you? Don't take a lift, take the stairs, try and walk as much as possible. Eat only 3 times a day, eat 2 times if possible.
Yeah.
Because there is so much food out there, so many calories, everywhere is calories.
Right.
Third is one of my favorites, which I'm not sure is actually studied, this is my personal view, is digital media. We actually dig a hole for ourselves because of digital media, largely around social networking platforms. There's good and bad.
Yeah.
You know, I'm not saying no phones, everything is allowed, but make it a habit to at least put your phone away at 9 p.m. as a policy, and pick it up in the morning at 8 o'clock. So at least 12 to 14 hours of no phone period is very, very important this day and age, because people dig a hole, they don't sleep. If they don't sleep, they get stressed, and they get stressed all night, things are running around. That leads to heart disease, but the root cause was indeed the digital platform on a device called phone. So put that out. That's 3. Number 4 is, of course, regular checks. And 5th, don't forget the 4 that I just said, and keep yourselves away from me or any heart specialist for that matter. So that's be the first and last advice.
Fair enough. Well, by way of closing comments, doctor, what's the impact that you'd like to essentially leave behind on the field of interventional cardiology? You know, what's the legacy you'd like to leave behind as a medical professional?
For the last few years, we have done 4 of the world's first treatments now, and that has led to thousands of patients being treated successfully in the world now. In the last 8 years, we've introduced 18 of India's first treatments, which is good, and that is very good. But looking into what is the deficit that we have in India, I think we have a little cardiologists, because I can only speak for my specialty. You'll be very surprised, for a country as large as ours, we actually need 80,000 cardiologists.
Wow.
Do you know how many we have?
I know the doctor to patient ratio is abysmal.
It's about 5,000.
Wow.
So who bridges the gap?
Right.
And how do we bridge it? You cannot immediately churn out 80,000 heart specialists. That's not possible. So with God's grace, hopefully at some time we will have a very homogeneous healthcare system in our country.
Well, Doctor, we certainly look forward to that, and we wish you all the continued success.
Thank you. Thanks a lot.
With that, our special feature, Revolutionizing Heart Health, powered by MGM Healthcare, comes to a close. We trust you found the insights shared of value. Thanks for watching.